On the other side of the Mozambique Channel, where the continents and cultures of Africa and Asia meet, Madagascar is renowned for its exceptional flora and fauna. Teeming with precious woods and minerals, this would be an idyllic island, if only its 20 million inhabitants could benefit from it. Relying on subsistence farming, 80% of the population lives in rural areas and in poverty. Letoa Lehoba lives with her 8 children in the village of Ambodi Hazomami. Letoa has lymphatic filariasis. This tropical infection has a prevalence rate of 15 to 20% in some areas, and more than 120 million people are affected worldwide. The World Health Organization describes it as one of the most disabling diseases on the planet. If an adult in rural Madagascar is no longer able to perform everyday tasks, it directly affects the family's ability to feed itself.
Quand il a eu des problèmes de crise, donc ils ont des problèmes sur de l'argent ou de quelque chose à manger, et pour se nourrir les enfants, ils trouvent des problèmes jusqu'à la crise reprend son état normal. En général, c'est la situation de cette maladie, c'est rend le niveau économique des gens plus bas parce qu'ils n'arrivent plus à travailler.
To combat this disease and its disastrous consequences, Handicap International runs an awareness and education program for people living in 281 villages on the east coast of Madagascar, one of the areas worst affected by lymphatic filariasis. Simple precautions like washing affected limbs in cold soapy water can reduce inflammation during attacks and help people stay mobile. Medication is distributed on a massive scale by the country's health services to curb the epidemic. But the remoteness of most villages, especially during the rainy season, makes this goal harder to achieve. Handicap International supports these efforts by raising the awareness of the local population. One of our top priorities is to distribute clear information to explain and demystify filariasis, particularly the form of the disease that affects the male genitalia. These discussion groups explain the disease in medical terms and clear up misconceptions that stigmatize victims. Thanks to support from Handicap International, surgery is now available for this particular type of filariasis. A dozen facilitators also help run health education programs in 18 local schools.
On est à Betamtam, dans une école primaire publique.
Alors on fait une petite séance d'évaluation des élèves sur la connaissance de la maladie filariose et la prévention et la transmission et surtout la prise en charge à base communautaire. Pour moi, c'est plus intéressant de travailler au niveau de la communautaire sur cette maladie parce qu'à Madagascar, surtout dans le côte-est, cette maladie est très endémique et plus élevé les taux. Il faut aider les gens pour comprendre comment faire pour éviter cette maladie et que peut faire pour prendre en charge cette maladie.